provisions of this health care bill. I don't want you compromising. I don't want you negotiating on it.
Yeah!
I want you and every single Republican who has not been represented, we are not represented in this bill or in Congress right now. I want every single Republican to get up and walk out and leave it to the Democrats.
Amen.
Until they get there, we're not a part of this bill. I don't want to negotiate on something that's horrible. And this is a horrible, horrible piece of legislation. It does nothing to reduce costs. Without fraud being reduced in Medicare, number one, without medical malpractice reform, it's a joke. And I don't want any Republican giving any kind of honor to it by even discussing it.
It's unconstitutional.
First of all, number one, you don't have to worry because we're not in the room. We have not been engaged in any, we've not been included in any negotiations, certainly not. I think maybe one Republican senator has, but let me also say to you, look, healthcare reform is vitally necessary, and here's why. Now, give me a minute now. The trustees that oversee the Medicare Trust Fund tell us that Medicare is going broke in 7 years, that it's going broke. Now, we have an obligation to fulfill the contract we made with our citizens in the Medicare program. So we have to fix it. That's why I'm presenting these things that we should do so we can really bring down the escalating costs of health care. The problem with health care in America is not the quality of care. In fact, it's the highest in the world. I was at a place called MD Anderson down in Houston. There were people there from, it treats cancer patients. There was people there from 90 countries in the world. They probably could have gone anyplace else, but they came there because it's the highest quality health care. So we have to preserve health care. But ma'am, I will be glad to show you the report of the Medicare trustees that say the system is going broke. I'll let you respond here a second. We've got to keep it from going broke. So we've got to stop the escalation of cost of health care in America. How do we do it? By instilling free market principles, by having competition, by having availability and affordability, and those things that bring costs down in America.
I am in absolute, total agreement. All I'm saying is that this bill does none of that.
I agree.
And by talking to Democrats about this bill, you're just engaging in something that's ludicrous.
Well,
this bill will never do that because the Democrats won't allow you to. That's why I'm begging you, every member of Congress who's a Republican and knows that this is a joke, to get up and walk out and let them have their day, because moderate Democrats aren't going to go with it either.
Thank you. I'm afraid you're right. But let me tell you what we do, and that's every morning there's some of us that go down to the floor of the Senate and talk about how bad this is and what we need to do. We need to talk, and by talking on the floor of the Senate, we are able to talk to the American people. And I know you want me to keep doing that, but I see your point. Yes, ma'am.